Have you ever felt a tightness or pressure in your chest while walking fast, climbing stairs, or feeling stressed? Many people ignore this warning sign, thinking it's just gas, fatigue, or muscle pain. But sometimes, your heart may be trying to tell you something important. One possible reason is a condition called angina. Angina is not a disease itself. It is a symptom that happens when the heart muscle does not get enough oxygen-rich blood. This usually happens because the arteries that supply blood to the heart become narrow or blocked. When the heart works harder, like during exercise or emotional stress, it needs more oxygen. If the blood supply cannot meet that demand, chest pain or discomfort can occur. Some people describe angina as pressure, heaviness, squeezing, burning, or tightness in the chest. The pain may also spread to the shoulders, arms, neck, jaw, or back. In some cases, people feel shortness of breath, dizziness, sweating, nausea, or unusual tiredness. One dangerous thing about angina is that many people ignore it in the beginning. They think the pain is temporary or harmless, but repeated angina attacks can be a warning sign that a heart attack may happen in the future. There are different types of angina. The most common type is stable angina. This happens during physical activity or stress and usually improves with rest after a few minutes. For example, someone may feel chest pain while walking uphill, but the discomfort disappears after sitting down and relaxing. Another type is unstable angina, which is more serious and dangerous. This pain may happen suddenly, even while resting or sleeping. It may last longer and become more severe over time. Unstable angina can be an emergency because it may lead to a heart attack very soon. There is also a type called variant angina, caused by a temporary spasm in the coronary arteries. Although it is less common, it can still be dangerous if ignored. Now the question is, who is more at risk? People who smoke, have high blood pressure, diabetes, high cholesterol, obesity, or a family history of heart disease are at higher risk. Stress, lack of exercise, unhealthy eating habits, and poor sleep can also increase the chances of developing angina. Sometimes the symptoms are not very obvious, especially in women, older adults, and people with diabetes. Instead of severe chest pain, they may only feel tiredness, mild discomfort, nausea, or breathlessness. That is why many cases are diagnosed late. Doctors usually diagnose angina through medical history, physical examination, ECG, stress tests, blood tests, echocardiography, or angiography. These tests help determine whether the blood flow to the heart is reduced. Treatment depends on the severity of the condition. Doctors may prescribe medicines that improve blood flow, reduce blood pressure, or decrease the heart's workload. In severe cases, procedures like angioplasty or bypass surgery may be needed. But lifestyle changes are equally important. Quitting smoking is one of the best things you can do for your heart. Eating healthy foods, reducing oily and processed meals, controlling sugar and cholesterol, exercising regularly, and managing stress can greatly improve heart health. Many people think heart disease only affects older men, but that is not true. Heart problems can affect both men and women, sometimes even at younger ages due to unhealthy lifestyles. If you ever experience chest pain that feels heavy, tight, or spreads to the arm or jaw, especially during activity, do not ignore it. And if the pain becomes severe, happens at rest, or comes with sweating and difficulty breathing, seek emergency medical help immediately. Your heart works every second to keep you alive. Paying attention to its warning signs can save your life someday. This is Health Diagnosis. Stay aware, stay healthy, and take care of your heart.